Good morning, everyone, and thank you ever so much for your interest and for attending on such a beautiful day. It's nice to see that people honored their commitment. I'd like to welcome everybody, and as Brendan said, we have a good number, and I'm thrilled to be able to say we have 9 different wellness centers and a literacy group from across the province. So thank you very much for coming on. I appreciate it, and great to see so many interested in this very important topic. Brendan has been pretty good at explaining all the housekeeping items for me. The most important, so we have a professional recording, is keep those microphones closed. And give us at least 5 to 7 days so to send out the link for the recording and the presentations. Both presenters have said that they have no issue sharing it with what they're going to be telling us today. So at this point in time, before I introduce our first presenter, I'd like to thank the Secrétariat aux relations avec les Québécois d'expression anglaise for the funding that has allowed us to produce these webinars. And we would also like to acknowledge and thank our partner, Educalois, for their support with this project. We will be having 6. So each month from now till the end of February, there will be webinars that have been, we promoted the ones till the end of the year. So if people want to register for October to December, I'm taking those registrations now. So without further ado, I'd like to present our first presenter, introduce him, Mr. Emmanuel Morin, and he is with the West Island, Montreal West Island CIUSSS. I think it's Integrated University Health and Social Service Center, and he is the Service Quality and Complaints Commissioner. Mr. Morin holds a master in criminology and a bachelor's degree in sexology, and trained in best practices for ombudspersons. He is also a member of the L'Ordre professionnel des criminologues de Québec, and in addition, he was appointed president of the Professional Inspection Committee, whose mandate is to ensure public security and top quality professional service. Mr. Morin is known for his solid understanding of legal frameworks and his legal and clinical expertise in the health and social service network, as well as his work with youth protection. As an experienced manager of 15 years of service in the healthcare network, including 4 years at Indigenous centers, or healthcare centers, and 3 years in upper management, he is previously the Associate Service Quality Complaints Commissioner at the Montreal West Island CIUSSS. Guided by values and principles of our organization, he is deeply committed to high-quality, collaborative approach, promoting the accessibilities of the complaints examination system to users, and targeting continuous improvement in the quality of care and services provided to the public. He was officially announced and profiled in August of 2020. That made him the permanent Director of Service Quality and Complaints Commissioner. And we are very fortunate to have Mr. Morin. He is extremely busy, as you no doubt can imagine. And yet he's very graciously offered to give us his expertise, his time. And the one thing I have to highlight, as you think of a question, please type it into your chat box. Katia, the Executive Director of Seniors Action Quebec, will be asking Mr. Morin the questions when we come to the question time on the agenda. Please don't wait till the last minute. We're suddenly ready to go to questions and we don't have any. So very important that you make a note of that and get those questions in. It also helps us avoid duplication. So if we get 3 that are the same, we're not automatically reading them off. We can work through it in advance. So without further ado from me, Mr. Morin, thank you very much. Really appreciate you giving us this time. I know you're going to have lots of questions, lots of information for us, and thank you very much. Merci beaucoup. I turn it over to you.
Thank you very much, Mrs. Pelletier. First of all, thank you for this opportunity to be here and to present this position. I'm very, very happy. Indeed, we are very, very busy, but a part of the job, a part of the task is to promote and to let know the law and what is the role and the mandate of the complaints commissioner. That's why I'm so happy to be here and to answer your question, because we are there for you. So it's important for me to step out of the job and make sure that, you know, we try to join as most people as possible. So indeed, I will go with my presentation, do a short review of the installation, and after that, we will see the mandate and my roles. I try to go shortly because the part of the discussion for me, as my experience, is the best part. I would like to be able to have your point of view or be able to answer your question. So first of all, if indeed we are in Montreal, West Island Integrate University Health and Social Services Center, CIUSSS de l'Ouest de l'île de Montréal. So I'm the complaints commissioner since 2021. I started before in 2018 with Mrs. Lynn Robillard. I was assistant complaints commissioner, so I'm at the office since about 5 years. So, and we don't become a complaints commissioner at the beginning of career. It's a very specific job. So, but I used to be on the inquiry, Native and Inuit people, the Commission vient just before that. So I had few experience with the complaints with the health and social services. So that's why I decided to join this beautiful office that we have in the CIUSSS de l'Ouest de l'île de Montréal. So in the next slide, we have the 5 primary mission in health and social services. It's very important because we are I'm calling my office generalist office, because we examine complaints for 5 missions. So we have the missions here. It's the CLSC. We have the Community Hospital Center and University Institute and Mental Health with a super regional mandate for indigenous clientele. So for Santé Mentale, we have this mission. We have the Youth Protection Center. So is it another important mission that we have? So we examine situation regarding the youth protection law. So it's important to know the law and the mechanism of complaints. We also have Readaptation Center for clientele with an intellectual disability or autism spectrum disorder. And of course, we have long-term residential care center, the CHSLD, on our territory, which we receive a lot of complaints and mistreatment. For the next slide. So those are the value of the CIUSSS de l'Ouest de l'île de Montréal, which is very important for us because we work with the organization. The complaints office is not under in the organigram. We are working beside the organigram because we have independency, and the agility, the respect, and the partnerships are the 3 important values of the CIUSSS de l'Ouest de l'île de Montréal, which are very necessary to improve the quality of services. And those values during the pandemic was very important. They were very important to build and try to go through this crisis at that time. Next one. So our territory, the specific of the CIUSSS de l'Ouest de l'île de Montréal is that we are the largest CIUSSS on Montreal. So we are very huge. It's specific for our office because we are a small team. In my teams, I have 15 employees. I have 4 assistant complaints commissioner. We have 5 complaints delegate, and 5 administrative agents with 5 médecins examinateurs. And we have to spread the teams over all this territory. So we are split. That we call satellite teams. So we have the teams is over many installation. My installation, by example, are at St. Mary's Hospital. So I'm going there in order to serve and to be present at this installation, but we have other people at other stuff. So since we have Hôpital Saint-Anne at the beginning of the island, and at the opposite, we have another CHSLD, which is Grace Dart, which is very, very large, and it could take like 1.5 hours just to be present and to visit this installation. So it's a big specific particular things with our territory. So we have 184 kilometers, including 8 cities and 4 boroughs. On the next slide. So we have our installation. We could see that we have the St. Anne Hospital. We have after the Lakeshore General Hospital, and we have the 2 CLSC around this territory, Lac Saint-Louis and CLSC Pierrefonds. And beside the CHSLD, we have Denis Benjamin Vigée at that part. The other part, the La Salle, Lachine, Dorval territory, we have Hôpital La Salle, we have the CLSC Dorval Lachine, CLSC La Salle, and all the CHSLD Dorval, La Salle, Lachine, and Nazaire Piché. We have also just beside the West Montreal Readaptation Center, which used to be called Chrome installation. After that, just beside in the Verdun, we have Douglas Mental Health University Institute. And not very far, we have Bacha Youth and Family Center for the English Youth Protection installation. We have St. Mary's Hospital, which is my place. I used to be in Lakeshore, but now we have Lise Doiron, which is my assistant complaints commissioner. But my office is at St. Mary's Hospital, and at the far in the east of Montreal, we have Grace Dart Extended Care Center. In those installations, it's important to know, because if you would like to complain about the CLSC Verdun, which we have installation, CLSC Verdun is not falling under my jurisdiction. It's more the CIUSSS de Centre Sud. So the name of the installation is very important in order to make a complaint under the good jurisdiction and competencies. On the next slide. So we have the 9 public CHSLD, 1 non-integrated CHSLD, 4 private, 6 private unfound. We call this conventionné, non-conventionné. And they try to do the convention for every CHSLD for a total of 2,000 places. We also have intermediary resources. So 36 for intellectual deficiency, ASDPD, 27 for mental health, 2 for youth, and 8 for support for elderly autonomy. We have 55 residents that we call SRQEA, private senior residence, so which we have a competency under the SRQEA. Not all the, we not examine everything, not the how you say in French, buy, but there's, when it's including a services, we are able to examine and analyze the situation that you could report. And we also have family type resource and intermediary resource shelter. We have 38 under the mental health direction, to close to 300 proximity foster family for youth, and 100 about for Chrome, AD, ASD, PD. So for the next slide. Okay. Now we are coming under the mandate of the Complaints Commissioner. So the Service Quality and Complaints Commission is responsible for the application of the facility's users' complaints procedure. Has all the freedom and independence necessary to carry out its function. This part is very strictly important because people think that we are under the organigram, that we are under the CEO, which is not true. We are under the Conseil d'Administration, which my boss is the Conseil d'Administration, and we work with the directors in order to provide information, to influence the direction, and to bring any information that could help to improve the quality of services under all the sectors for the organization. So this part of the independence is very important in order to be able to give input to help the organization to improve the services. He's here to listen and ensure that users' rights are respected. It's the first thing we do is to listen and make sure that we are able to provide the rights information for the user. And we could make recommendation to the board of directors when we have a situation that needs to be brought up. Next one. So the part is very important too, is if you're able to screenshot this part, or I'm sure you will be able to receive the contact information. If you wish to receive more specific information, if you believe that you didn't receive the proper services, you can call us and we'll give you the information. Okay, so we usually give this information at the end, but I say no, give the information as fast as possible for everyone to have the information in order to be able to reach us. So we have 5 administrative agents that could answer to you, and if needs to be answered and examined, your situation will be provided to a delegate or an assistant complaints commissioner. For the next one. So who can make a complaint? First thing first, it's the user. Only the user, okay? Or his legal representative, for the reason that we know. Sometimes we have a beloved one who is very difficult to lodge a complaint, so we could accommodate a daughter or a son or someone in the family which would like to accompany this person in order to complain, but it's important to have the consentment of this person. So it could happen that sometimes someone, a relative, will not be able to open a complaint file because of the law. It's the law, and it's regarding most the consentment of the person. We really need to have that. It happens sometimes that there's conflicts between the family, and we're not here to mediate that, but we will give the information and we'll try to assist this relative to try to help a situation. Okay. Next one. What kind of complaints can be received? We receive a lot of complaints, and this part is very important as well because first, the two things that are important is it's every services concerning care and services that user receive, ought to have received, or is receiving or require. So sometimes the situation happen like few days, few weeks, maybe sometimes 1-2 years. So we could examine that situation. Sometimes you're receiving the services right now and you would like to lodge a complaint, so it's also receivable. So we will help you to and help the direction to at that times we will try to mediate first the situation because you're receiving the services right right away. Concerning services offered by the institution in general. So any services that you receive when, and I give the example, when you're putting your foot on the installation, you're starting receiving services as a visitor or as the user. So, but it's our job and it's our duty to make sure that we will examine and see if you really receive the services that which be able to examine the situation. If you're not falling under our jurisdiction, or if you didn't receive services, it will not be eligible. Next one. So when you are working on the complaints office, you have those 4 terms, very important terms. The first and the most easy one is the complaint. Of course, you are a user, you receive a bad services, you had a difficulty with the staff, and you're not satisfied of the quality, you can lodge a complaint. Okay. When I spoke earlier about a relative that were witness of a situation of his mother or a family that receives services treatment, or someone that would just want to receive services but doesn't want to complain, will fall under the assistance. One of our job, it's important, is to assist every person under the big mission of the installation, which I present at the beginning. You know that the services, sometimes it's complicated to reach someone, to have the good services, the good person to receive the services. So sometimes it's not necessary to examine a situation. Sometimes the good option for you is to be assist and receive those sort of services. So it will fall under the assistance. Another thing that is important for our mission is that the complaints commissioner or their assistant, they could open an intervention. So it means that I don't have to wait that a bad quality services happen. We could intervene right away with information that we receive from the staff, from the media, from me that will walk the installation, and I'm witnesses of some things. If I judge that we need to examine the situation, we will open that what we call intervention. And those I speak about the law, the L4S, the Social and Services Law, but we also have the maltreatment signalement. The maltreatment signalement will be under the intervention as well. And the fourth one, the consultation. So my presentation will fall under the consultation, which is a part of my job, is to present and to make sure that people know our rights to do a complaint. So it's very important that when you go through the services and you are dissatisfied with the services, that if you ask to have the information of the complaints commissioner, the staff will be able to give you the information and give you the rights to do it properly. So the consultation, it's for everyone, needs to be informed. the staff as well as the user will use the consultation. So it's the four important tasks we have under the law. Next one. Medical complaint is under our duty as well. So if you any medical act that you receive will fall under the médecin examinateur, which I received the complaint and I will provide to one of our four medical examinator. But it's important, the complaints commissioner will not be able to examine the situation, but we work together, me and the medical examinator, in order for me to review if the examen is properly done. But the act, the examination of the act is only under the medical examinator. And we have every user, everyone could make a complaint, which is not the case for the non-medical examinator, the non-medical complaint. Only the user and legal representative will be able to lodge a complaint. But when it's a medical act, everyone could lodge a complaint. So it means it could be a relative. The complaint must be submitted in writing. This is the difference. The deadline is also 45 days to conclude the examen. So open to anyone, including employees. So it's the big difference. At the end, the conclusion for someone it's not the user, the information will be more limited. It's the big difference between the complaints examination. Next one. Oh, I'm not sure if there's other. Okay. So most frequent complaints motive. Of course, we receive a lot of complaints regarding the care and services rendered. And after that, the second one is the interpersonal relation. Those two big motive that we receive. But we also have complaints regarding access of services. We also have motive regarding the organization, the installation, and we have also for the financial services sometimes. Next one. So that's the end of my presentation. So thank you very much to have listened to me. And I hope I will be able to answer the question that you could have.
Thank you very much, Mr. Morin. That was most informative. And I think we've learned a great deal about the importance of making a complaint, the role and the different levels in which to do so. And I assume that this applies to all geographic regions within the province. They all have their own CIUSSS. And Kathy, I believe you have some questions, and I'll turn it over to you.
Okay, I'm going to move the camera a little bit. Okay. Good morning, everyone, and good morning, Monsieur. I'm just going to get comfortable 2 seconds, Monsieur Morin. Thank you very much for your presentation. So I've been keeping tabs on the questions, and I'm going to try and find a way of asking you the questions in a way that makes sense. So my first question is just to clarify, in each CIUSSS and SIS, whether it's in the Greater Montreal area or throughout the province, can you just explain again where the Commissaire aux plaintes is? Is it in one headquarters or is it in each institution?
For the Montreal territory?
Well, the Montreal territory, and maybe if you could also just explain outside of the Greater Montreal area, if that's possible. Yeah,
we have 6 complaints commissioner. We have the CIUSSS du Nord, CIUSSS de l'Est, CIUSSS Centre-Sud, CIUSSS Centre-Ouest, which is just beside us. And we have CUSUM and the CHUM. So I know all those partners, and our territory is the CIUSSS de l'Ouest. And it's not very important to know where we are. The important is to, that we have those 4 hospitals: Lakeshore Hospital, St. Mary's Hospital, Hôpital Sainte-Anne, Douglas, Batcha, Youth. All those services are there. So the important is to have the line. So we have many person on Hôpital La Salle, but in Lakeshore, most of the big hospital, we have someone there at the entrance, but all the complaints will be made by phone or by email. So it's the best way to reach us.
Okay. Okay, so I just want to clarify. So is the steps to file a complaint the same if in your region you have a CIUSSS, so a Centre Intégré Universitaire de Santé et Services Sociaux, or if you have a CISS, which is a Centre Intégré de Santé et Services?
It's the same. It's the same for
steps.
everyone. If you would like to lodge a complaint, you just need to have the contact and the proper installation. So the link between I give you the example of CLSC Verdun. CLSC Verdun, even if we have a CHSLD just beside, CLSC Verdun fall under Centre Sud. So it's important and the staff, the employees, they are aware of that. So they are supposed to know that the complaints of CLSC Laval is Céline Roy, my colleague from Centre Sud, and we know that. Even if you email, you receive the email, we will give you and assist you to give you the proper territory. Sometimes it's confusing. I acknowledge that. It's sometimes the administrative agent often they refer because people ask who is able to examine this situation, so it could happen.
Okay, perfect. So whether you live in Laval or you live in the Gaspé or you live in Abitibi,
the same.
Same
it's
step.
the same. It's the application of the régime d'examen des plaintes, which is the same for everyone.
Okay. I'm just crossing off my questions on the list. One question, in the presentation, Emmanuel, you said that the people who can file a complaint is either the user or the representative of the user.
Yeah, exactly.
So if someone needs to file a complaint on behalf of someone, do they need so you said they have to give the user has to give consent.
Exactly.
Okay.
Yeah.
So can you just clarify what consent is? And secondly, does the representative need a legal document to say that they are
Good
representing?
Good question. The law said that we need to be flexible and accommodate. So it could be just someone, the beloved one, the user is just on the phone. So you just give the phone to the other person. We don't ask for a formulaire or some things that will complicate the examen. But it needs to be, for sure, the delegate or the person who will call you will ask you, are you the representative, the legal representative? Or if it's not the case, you will ask, okay, maybe sometimes it's the spouse or, is she just beside? Could you just ask her if it's good that we receive and exchange information? Because it's about the exchange of information that we have. And sometimes it needs to be reminded there's a conflict between families, and we don't want to exacerbate a situation or tension in the families. So, but it's not necessary to fill out a form or some things like that. We try to accommodate and understand that sometimes it's difficult for elderly person to complain. And yeah, exactly.
Okay, but I just want to make sure I understand. So
yeah,
in the presentation, you said that a complaint has to be formally written down. So you have to have.
No, it's for the medical examiner.
Okay.
For all the non-medical examiner, you don't have to write it written down the complaint. It's just for the medical examiner because the act is very important, and the experience show that you are better served when it's written down, and we could assist you to write down your complaints. For the rest, okay, for every user which that it's not a medical examination, so non-medical, which is a big part, it doesn't mean it's not necessary to write it down. The delegate will help you asking you question, and he will write it down for you. Or there's an organization that called the CAP, the Centre d'Assistance et d'Accompagnement aux Plaintes, who will write it down for you. So this part also, the delegate will present you this option if you would like to write it down, but you're not able to do it. Okay. In fact, the part of the medical, it needs to be write it down. We could assist you on that. And the part it's non-medical, which is a big part of the volume of our complaints, it's not necessary to put it down.
Okay,
It could be verbally.
Okay, perfect. And a really good question just came in.
Yep.
Emmanuel, can you explain the difference between a medical and a non-medical complaint, please?
It's the act. When a doctor made an act, it's medical. When it's administrative situation or non-medical, it's under the non-medical act. So if you visit a medical doctor and you didn't like the information, the tone of the medical, the doctor, it will be another doctor who will have the power to examine this, just that. So if it's the organization, you're not satisfied with the organization, it's my task. I will now examine that part. Or the care and social services, health and social services, it will be under my jurisdiction.
Okay.
I'm not a doctor. If I'm not a doctor, I will not be able to examine it. I will have the authority to revise the conclusion, and because it's my role, the medical examiner are under my competency, but I will not be able to examine a medical act. I'm not a doctor.
Okay. So within that, I'm going to ask you a 2-point question. What is the kind of, entre guillemets, normal turnaround in filing a complaint? And after a complaint is filed, what is the success rate of the complaint process?
What do you mean by normal?
Well, I was
Average.
like there. Thank you, Ruth. An average turnaround. So from the moment you file a complaint to someone, a delegate calls you to start the documentation, and then next steps. What's the normal turnaround for something to happen?
Turnaround, you mean the delay?
Yeah, exactly.
The delay. Sometimes sometimes we could answer right away because we have the answer. So we call this a 24 hours complaint. So we receive a volume of complaints that we know that this part of the services is difficult, and we could give you the information, the recommendation or the improvement measure are done or in a way that will be done. So we could right away give you the conclusion. Sometimes it will take time in order to review documents, to meet with staff, because it's interpersonal relationship, and so we'll have to go to that's we call équité procédurale. So we need to have the point of view of the staff and the manager, and to examine and after analyze that. So it could take like 30 days, 20 days sometimes. By the law, we have 45 days to answer to you. We try to go over that delay, but sometimes someone is in holidays, or there's some change. So it could sometimes take longer to examine the situation. Sometimes usually we have 10, 15, 20 days to examine the situation, depending on if we are very busy or not. Most of the time we're busy.
Okay, and what is the success rate, if you will, of complaints being filed?
It's a difficult question, but
Mm.
most of the time, one complaint to 1 sur 2 will give us improvement measure or recommendation. Okay, and the difference between recommendation improvement measure is quite different, because improvement measure is the acknowledgement of the directions to improve themselves a situation. So we call they acknowledge the situation, and they said they will make a change. We call this improvement measure. Sometimes it's my duty to recommend, because two directions have to work together, and and services are the services. It's not the fault of everyone, but the organization made some recommendations. So I would say that 1 complaint to 2 will give us 1 or 2 or 3 recommendations to improve a situation. It could be a reminder to our teams to be sensitive with users. It could be improving a politic or procedure in order to facilitate the services.
Okay, so my next question would be, yes, I will start with this question.
Yeah.
I'm trying to do things chronologically. So so already it's very intimidating for most people to file a complaint.
Mm-hmm.
Right? So how can people get the information that they need so that they can, for lack of a better word, self-advocate for themselves and either file a complaint or turn to someone that they can speak to? So where's the best place for people to get that information?
First, they need to know that it's a constructive action to improve to report a situation in order to improve the quality of services. And it's very important to the people to know that the direction and the organization really wants those information, because they really need to, they know that they needs to improve the quality of services. And the quality will change during the year. Sometimes a direction or sector is going very well, has a high rate of satisfaction, and 1 year after, for many reasons, it changed, and our complaints office will be able to provide information saying, we receive like a high rate of complaints regarding this sector, so we will try to provide the input. So for sure, our delegate and our staff are really good to sensitize people and make sure that they feel comfortable to improve to receive the information of the user. We're good at that, and we try to always make sure that people feel comfortable doing it. You can be accompanied with someone. There's many situations, but our staff is very patient with people that need to take times to report that. And we have many team building in our teams to make sure that we remain vigilant with that. Okay, it's important that every cause we receive is someone that has the courage to bring some things, and we want to keep this to try to give you the information as fast as possible. And because we're working on the complaints and the maltreatment situation as well. So if someone is maltreated, we need to prepare and to be expert on that part and be able to listen to the people.
Well, that's great, and I'm happy you said that, and I'm leaving the big question for the end, so we've got 3 minutes now. So now that you said that, my second question to that is, can these services, information, or even filing a complaint be done in other languages than French? So be it in English or in Spanish or in Mandarin or in Portuguese. the big question.
Of course, it's an easy question. I received complaint from in Inuktitut, and we translate it in Inuktitut. So we takes times Arabic, English, French. I'm sorry, forgive me for my mother tongue is French, but I
You're
need
doing great. You're doing absolutely fine. Do not apologize.
Thank you very much.
You're welcome.
I know the mechanism of complaint, so it's easier for me time by time. But yeah, we will try to accommodate because we really want to make sure that everyone's, and we have a population that we have many communities, and we try to stay very close to them. So we'll try to find a way to have a translator. We already work with translator for Arabic, for English, French, or our team is the same. We have black, white. We have other members of the community in our staff. It's English, French, and we try to be the most multidisciplinary teams, because we want to have diversity in our teams. We really believe on that.
Great. Well, merci beaucoup. And I'm gonna merci à vous. I'm gonna mute the camera. I'm gonna mute the mic, and I'm just gonna move the camera so Ruth is back in frame.
Thank you.
There you go. We're ready. You're ready.
Mr. Morin, thank you so very, very much. And I hope everybody who was watching and listening feel encouraged that they're hands-on with their elderly family member, friend who is in an institution or in the hospital, so that you can be aware of what's going on. And I can't emphasize enough, because I think this is one thing that concerns me, that all seniors should feel very encouraged that if you have a situation where you're not happy and you feel that the service is not up to par, if it's medical, it's a specific system, and it's a medical person who will handle that complaint. But if it's something to do with the air quality, the food, the activities, the manner in which you're spoken to, then it will be someone like Mr. Morin, and each region has their own commissioner of complaints. And I'm also very encouraged to hear that, because one thing that does stress seniors is, I may be verbally bilingual, but when it comes to forms, it comes to explaining myself, je suis très limité avec mon langue. How do I express myself? To be reassured that for health matters, that they can address it in English. So this is very reassuring. And Mr. Morin, I thank you for your time, because I know how busy you are, and I know how many establishments you have. And I'm very grateful that you're there, because we need people like you to monitor the system for us. And I know some people have put their affairs in order, and they have given somebody a mandate for their health-related services. And others don't, but they have a caregiver, or they have a partner, or someone who's very close to them. And we always advise people to have someone with them, because you get forgetful, you get stressed, and you may forget something important to say, or what you're being told. So I thank you so very, very much for your time, for your expertise. And as we said earlier, your presentation will be sent out to the link, and people in the regions who are with us or couldn't have all their members attend, they could have it in their local regions and present it again, and maybe have a local expert come and talk to them, an equivalent to you. So I have to say thank you very much. Now we're going to go for a health break, and we're going to come back at 11 o'clock sharp. So you can stretch, get a cup of tea, coffee, and come back. And then I'm going to introduce our next presenter, Mr. Morin, if you would like, you're more than welcome to stay, but if you're busy and you have to leave, we thank you very much for your time.
Mrs. Pelletier, thank you very much. I give you the same congratulations for the organization, and I hope I will be able to join you again. Thank you very much for the invitation, and for everyone, you deserve dignity, the quality of services you're supposed to receive. Don't hesitate to
Oh,
call
I've got
us.
your number now. I never lose a number.
Yeah, and if you really would like to speak to me, go. We'll try to. Don't hesitate to. We have a staff that really good to listen to that, and I'm sure we could improve the situation and help you on that.
And I must take 2 seconds to pass on for your information. Madame Joseph is superb.
I like it's my tour de contrôle. Francia Joseph, it's really good. And you know, we're a big team. She tried to help you, to represent me, because I'm busy, but I'm so pleased to be with you, and it's really important for me to let the mandate understand. Thank you very much, Mrs. Pelletier.
Merci beaucoup.
Thank you.
So we'll come back at 11, everybody. Thank you. Well, welcome back, everyone. I think this morning's session so far has been absolutely excellent. Mr. Morin gave us a great deal of information, and I know this segment is also going to be equally valuable, and I'm delighted that we were able to get Farat Joachim, who is a passionate clinical nurse manager of the primary care line at the Montreal West CIUSSS, with 17 years of experience in the healthcare field. Farat has developed strong skills in team management, care coordination, and in process improvement. She is eager to continue applying her expertise by contributing to the application of organizational priorities and the continuous improvement of services in the role of first-line access process coordinator. Farat is also with the CLSC Pierrefonds, and I happened to be at your building last week, but on the 3rd floor, and I believe you're on the 2nd. It's a delight to actually put a face to the name. We've been talking and emailing back and forth, and you're going to tell us a lot of valuable information, because we all know, and some of us have experience, some are still going through it. Some are worried that what do they do if their GP retires, because we know there's 6.5 million Canadians that are without their family doctor. So Farat, without further ado from me, thank you for giving us your time, your expertise, and I'm going to turn it over to you immediately. It'll be the same process. Keep your microphones closed, and we will go to a question and answer period. So do have them in the chat box so we're ready. Thank you.
Thank you. Thank you very much for having me today. And before I start, I think it's important to say that, yes, I am everything that Mrs. Pelletier described, but before anything, I am a daughter of a mother that is a senior citizen now, that needs help to navigate the system. I am a wife, I am a mother, so I care deeply about things that are relatable to you on a daily basis. So these are the same concerns that I have for the healthcare system, the care of my mother, the care of my kids, my husband. So before all those titles, I am human, and I can relate to anything that is going on in terms of your concern. And it's a pleasure for me to be able to assist the committees here today to navigate the system. And so like Mrs. Pelletier said, my name is Farat Joachim, and I am a manager at the primary access point in the CIUSSS West de l'Île. So I represent the West Island territory today, and I've seen already questions in the chat, and I cannot speak for every territory because we don't necessarily face the same issues in terms of people that are working on the territory, family, like the amount of family physician, amount of nurse practitioner, nurses. So each territory do face different challenges, but I will answer to the best of my ability, and I could definitely answer for the West Island territory today. Okay. And another disclaimer, I am French, very French. And with that being said, some words might not be pronounced properly. So feel free to clarify anything that you need to clarify either in the chat, and Katia might be able to clarify by calling out the questions later on. And with being nervous, some questions, some words might not be pronounced properly as well, but I will do the best that I can today to help everybody. Okay,
I'll back you up if needs be, Farat, no problem.
Thank you very much, Katia. So Mrs. Pelletier, when she reached out to me, she did express certain concerns, questions that she had that were probably coming from the elderly population on how to register for a family doctor. And I wanted to start the presentation with that because a lot of us right now do not have a family doctor, and we don't necessarily know how to get one. First step is by some people were before doing door-to-door asking different doctors, or can you take me on as a patient? But from this year, the ministry has passed a law that everybody needs to be on the waiting list, which is the GAMF, it's the Guichet Accès à un médecin de famille. And I'm sorry, it's all French acronyms, but I'll translate them. So the waiting list is where everyone needs to be, and that's where the doctors are only allowed to take patients from that waiting list. The waiting list is a place that is registered by each territory. And for the West Island, we have a number here that you'll be able to have with the presentation, 514-630-2225, extension 5235. And you have admin agent that takes down your information, your healthcare problems, the situation that you're in, and by doing so, she's able to register you to the waiting list for a family doctor. Or if you're somebody that's able to navigate internet quite easily, I have put in the website address there as well. And you could do the same process, but online. So it's not because you're talking to an admin agent that the process is faster, because she's filling in exactly the same things that you would be doing if you're doing it online. It's just that you're having assistance by somebody else to do it. So you could register that way. And some of the things that they'll ask on to register, it's details on your medical history, if you have any chronic illness, any frequent visit to hospitals, any concerns that would make you a priority. Now, considering that there's a lot of people with chronic illnesses, diabetes, hypertension, it doesn't necessarily make you a priority because of that. It does put you in a category of priorities, but because there's so many people with the same chronic illnesses, there's still a bit of a waiting time, even if you have those medical history, right? So on the West Island territory, the average waiting time definitely varies depending on the priorities of your medical history. But on average, it's about a 3-4 year waiting time before you get a family physician. And I like to say that the only reason why it's that average is because the only way we can assign you to a family physician is if we have new physicians that are graduating, so they're able to take new patients. If a doctor that comes to our territory and doesn't have enough patient in his practice, so they'll flag us to have new patients. If a doctor has patients that is moving to a different territory and the patient can no longer come to that doctor, then it frees up some some space. So the doctor raises their hand as well and say that, you know, they're able to take new patients on as well. So those are the only time that we're able to assign a doctor new patients, because and now that we have the nurse practitioners that are going to be able to take new clients as well, we're going to be able to assign new patients to nurse practitioners. And but for now, these are the criteria that facilitate having a family doctor. We're going to go to the next slide. So if you have a family physician and the family physician retires or passes away or relocates, there's several obligations from the doctor or the clinic. So usually, let's say a doctor retires or relocates, we have to give 2 to 6 months delay to the clients in order for them to be aware in a proper amount of time, and to allow the clients to be able to register on the GAMF, the waiting list for a new family physician. Okay, and that doctor does have the requirement to help transfer the patients to another family physician from that clinic if another family physician would have the possibility to take new patients because their practice is not complete. They still have room for new patients. So the doctor usually seek out help from their colleagues, and they have to also make the patient medical file accessible to the clinic or the FMOQ. So let's say it's a case of a patient that passes away. Well, the clinic has the patient's file, so the patient is always able to have access to their file through the clinic, or the FMOQ, which is the Family Medicine Organization of Quebec. So it's the Order of Family Physicians. So they also have the facility to access patients' file as well, to be able to provide a continuity of care. It's a doctor's responsibility to prioritize patients' well-being during any practice changes. So like I said, seeking help from colleague, trying to find solutions. And I've seen it myself firsthand of physicians that were retiring, and oftentimes they really care about their patients. So they're going to try to find solutions. They're going to try to see before putting them on that waiting list, because they know they're not necessarily going to be able to have access to a family physician. What else can be done? Is there another doctor, another clinic that I don't know about, or like new doctors that are coming on that maybe the CIUSSS have heard about, so they want to inquire about that to see if they're able to transfer their practice. So they always seek out different ways to assist the clients. So we're going to go to this next slide. So with that being said, so what happens to your medical file? You have access to your medical file at any time. It's either through the clinic or through an hospital. And clinics and hospitals are required to secure your medical file in a secure, proper way. And you are allowed to have access to that medical file at any time that you require. Usually the process takes about 30 days. Okay, you have to oftentimes fill in a form. And you give it to the clinic or the institution like the hospital. Oftentimes there is a fee associated to that, and it varies from places to places. So I've seen up to $50, $30 to $50 is usually the average that I've seen. And then it requires about 30 days, okay? And when you're changing doctor, you have to sign a disclaimer form that allows the new doctor to have access to your previous medical file, and you'll pay that fee to the clinic, and they'll be able to transfer your file within the 30 days. And like I said, it's just by filing a form, a consent that you agree to transfer that medical file. We can go to the next slide. So let's say you have any non-emergency illnesses that don't require you going to the emergency room. Okay, we have the telehealth option, which is 811 option 1, which is an assessment by a nurse that analyzes, does a triage of the situation that you're going through and provides healthcare guidelines to assist you and what to look for at home and when to go to the emergency. Let's say the situation deteriorates. So this is through the 811 option 1. So if you have a family physician, the best option for you is doing the even if you don't have, that you have or not a family physician, 811 option 1 is a triage by a nurse. And like I said, they give recommendation based on your medical situation. Let's say you're going through any social crisis. You need social forms to be filled out in order to receive some type of security assistance from the government, or you have a social crisis where you might be put out of your house or apartment, or somebody in your family is going through a social crisis, like mental health situation. We have Info Social, which is 811 option 2, and this is an assessment by a social worker. These two lines are 24/7. I have to mention that. So there's always a social worker on call. There's always nurses on call through the 811 option 1 and 2. And depending on the situation, they'll be able to provide you assistance and recommendation on where to go and whatnot. Now, we have also the Guichet accès première ligne, which is the GAP, where you see 811 option 3. This option is mainly for people without a family physician, because as a new initiative of the government in 2022, they wanted to be able to provide a social healthcare security for people without a family physician. So this line has been put for people without a family physician, where you also have a triage made by a nurse initially. And based on the situation, if you need a medical appointment, an agent will be able to provide you a medical appointment. So the purpose of this service was mainly to be able to be assessed by the correct healthcare provider. So you're starting out with a nurse, but if the end goal of the call would have been to be seen by a social worker or a nutritionist, we're then directing you directly to that professional without having to go through the doctor, simply because doctors are not necessarily able to answer all the need of the healthcare system. Other professionals are also able to, so such as a pharmacist, like I was saying, nutritionist, social worker, nurse practitioner, nurse clinician. So by going through the nurse, she assesses the situation and then direct you to the proper healthcare service. Okay, and for another issue with non-emergency illnesses, we have what we call GMFRs, which are super clinics. So those are clinics where you're able to book your appointment online through Bonjour Santé or RVSQ for non-life-threatening issues. And we'll go to the next slide where I describe a bit more the GMFR. So it's to provide a faster access to care for non-priority health issues, like we were saying, and help patients avoid emergencies. So oftentimes those super clinics, they have X-ray labs at the same facility. They have blood work labs at the same facility. Yes, they do require fees, but you're able to, it's like a one-stop place. Now, they are usually open 7 days a week. They see people with or without a family physician that are registered at that clinic or not. They have nurse practitioners, and it's either any physician that is on call that day you'll be able to see, even if you have a doctor at the same facility. Okay, so it's an addition of any standard services that are offered at the GMF. So GMF stands for Groupe de Médecine Familiale, where a group of doctors works together, right? So it's in addition to any of those services. So like I said, they have public blood testing services. Sometimes they require a fee, and imaging services on site or nearby. And those are covered by the RAMQ in terms of the imaging services. So we'll go to the next slide. Okay, so like I was mentioning before, the primary access point, the GAP, is a new initiative that has been put together for patients without a family physician. It receives call from patients without those family physician for punctual healthcare needs services. So I have a cough, I have a UTI, I have a pain in my arm for the past 3 weeks, like punctual services. So you call, the nurse triage you and orients the client to the proper resource. So let it be pharmacist, let it be nurse practitioner, let it be nurse clinician, because now with the nurse clinician, as you know, the scope of practice has been expanded, and with collective orders, they're able to treat a lot more issues such as UTI. So you don't have to necessarily wait to see a doctor for that. Strep throat, you don't have to necessarily wait for a doctor for that. So those are things that we're able to facilitate. And pharmacy now have, pharmacists have a broader scope of practice, or they're also able to prescribe on site a lot of things based on the condition. So those are great alternatives as well. And at the GAP, we also have, like I said, a nutritionist, a social worker as well. And we have also developed like 22 trajectories, let it be with home care services, let it be with jeunes en difficulté for the youth, let it be with, like I said, the pharmacists. We have different trajectories to facilitate the trajectory of the patient and help accelerate the care that we're able to give. Now, there's a gap on every territory in the Quebec, on the Quebec territory. And unfortunately, the gaps do not operate all the same in terms of the resources, because depending on where you are located, they might not have a social worker or nutritionist, based on the fact that with the comment dire, pénurie de main-d'œuvre. Katia, maybe you're gonna be able to translate that.
Pénurie de main-d'œuvre,
Worker shortage?
that's exactly it.
Okay, there you
I've had
go.
one coffee, so
Yeah. And I've had decaf, so it doesn't help much.
Oh,
But
dear.
yes, worker shortage. They might not have the same services because they're short on staff. So, but the goal of the ministry is to have the same services across Quebec. So we're really working hard to provide that in different areas. But the goal of the GAP is to have those basic services. So at least somebody that doesn't have a family physician is allowed to have the same services that if they would go to a GMF for a punctual service. So the same access to a social worker, the same access to a nutritionist that you would have in the GMF, the same access to a nurse practitioner. The only difference is at the GAP, we don't have a family doctor. So the GAP clinic is run by a nurse practitioner, nurse clinician, and nutritionist and social worker. If you do require to see a physician, then when you're being triaged by the nurse, then she determines, okay, well, we'll be able to send you to see a physician or the nurse practitioner, or depending on what the issue is. Now, to contact the GAP, it's also 811, but this time it's option 3. And I have to put emphasis on the fact that option 3 is really only for people without family physician, because sometimes people with family physician does the option 3, by by mistake, but because you have a family physician, the system won't even let us go through. So everything is really managed by the ministry, and the system dispatches. And when the system recognizes that you have a family physician, we see it and we have to refer you to the family physician, and they won't even give us option for appointments or to continue with different services at this point, because you already have that security through your clinic. So I have included the phone number for the gap here, and also the website should you choose to, this is something important that I have to say as well. So 811 option 3, again, when you call, you're being triaged by a nurse. But before reaching that nurse, you have an agent that picks up and dispatches to the different territories. So all the calls are answered in Quebec, at a central in Quebec. And then the central in Quebec, based on your postal area, code area, dispatches to the different areas of Quebec. So then you reach the nurse. So if you choose to do it online, you could go directly at the address that you see below, but it's also the same process. So you fill in the form online, but when you call 811 option 3, the agent in Quebec fills in the same form online. So it's not a different priority because you talk to somebody, and it's a virtual wait. So once you fill in the form, when it's your turn to be triaged, the system will call you back with the information that you have given on that form, and then you proceed with the nurse. So I think it's a good alternative, and people that are not necessarily tech savvy or comfortable with computers, 811 option 3 is definitely a good option for you. But online is also something that's hassle-free, and it's very intuitive. Whatever answer that you fill in, it brings you to the next page and ask another series of questions. So it's very simple to maneuver. You might want to explore the page like when you have time, and just to see what it's about. So it's not when you're in need of the service that you do it, because then we're sometimes more nervous and we have less patience. So at least you're able to see for yourself what it's about, and when you need it, you're able to use it freely. So this concludes my presentation. I think I've spoken very fast, so I'm pretty sure I'll have a question. So feel free to ask any questions that's needed.
Thank you very much, Farah. That was excellent, and you answered so many questions.
Okay.
But I know that Kathy has some more for you. And I think it's very wise. The advice that you gave us is to go online now and look at the form, so we are prepared, that we're not trying to deal with an emergency or, you know, not feeling well and trying to do it at the last minute. So thank you for that tip. Katia, do you have some questions?
Yeah.
We're playing musical chairs here.
Yeah.
T'es prête?
Oui.
Okay. So my first question, Farat, is so you said in your CIUSSS, so the Centre Ouest de l'Île de Montréal.
West de l'Île de Montréal. West de l'Île de Montréal. Because there's Centre Ouest, and then there's West de l'Île de Montréal. So it's two different.
Sorry, I always.
It's okay.
My brain.
People,
okay.
yes, people get confused, but I just want to clarify because I don't respond for them, right? So
no, that's okay. I thought I got the right name, so I was very proud of myself for 2 seconds. Clearly, I didn't, but that's okay. But my question is: so you said the average wait at your CIUSSS is 3 to 4 years, give or take.
Exactly.
Okay, so what happens? Well, my first question is there a cutoff for how long someone has to wait for a GP?
Unfortunately, no. No, because the only way that we're able to assign GPs, once again, is when we have new doctors coming on the territory, and that it's based on where the doctors wants to go once they graduate, right? It's based on the fact that, let's say, a practicing doctor has patients that move or pass away, unfortunately, then they're able to take new patients. So those are not factors that we can facilitate, right? We're not in charge of those factors, so we have to wait, and because of that, then there's no maximum of time. But from what I've seen on our territory, it's usually 3-4 years.
So what happens if someone is on a waiting list for, say, 5 or 6 or 7 years? Is there any recourses that they could do to, how can I say this, speed up the process?
Speed up the process, no, but I do encourage anybody that's been on the waiting list for a few years to contact back their guichet to see if they're still in the priorities, to update their file. So we have usually nurses at the GAMF, so at the Guichet d'accès à médecine famille, that does repriorities. Every 2-3 years, we call back patients to make sure that their healthcare situation hasn't decreased, there's no new health concern, and like they have access to talk to a nurse at the GAMF as well. So we're usually, like I said, 3-4 years is what we have seen on our part.
Okay, and I'm going to go a bit on a tangent. So what happens if someone, if they're optometrist, ophthalmologist, or specialized doctors, so cardiologists, endocrinologists, I can go on. What happens if they retire? How do they go on a waiting list? Is there a waiting list for them? That's similar to the GP, say.
Okay, no, for the specialists, there's no waiting list. So it's really a matter of sending the referral to another specialist, because all those that you've mentioned are specialties, right? So let's say I'm being followed by an ophthalmologist and they retire, then I have to send a referral to simply another ophthalmologist that can take me on. So this is knocking at doors and seeing, okay, can you take me on as a patient? Because those are specialists.
Okay, a question, I'm multitasking right now. A question just came in. So as a patient, you have to be on a waiting list if your doctor retires or what have you, or because of quotas, say. So this is a bit of a strange question, but what happens when doctors' patients pass away? If a patient passes away, can they just take on a new patient after they've lost a patient? And
that's what they do. That's what they do. So they reach out to the GAMF saying, okay, well, now I can take 10 more patients or 2 more patients, depending on the numbers that they're asking. But usually that's what they do. They have to reach out to us to tell us the amount of patient that they're taking on.
Okay, and okay, so just to go back to the gap, I have a couple of questions on that. So you say that the gap is to improve access to primary health care for people. So they put in, they get an appointment and then they get to see someone. So where do they see that medical person? Do they see them at a CLSC? Do they see them at home? How does that work?
Okay. So depending on where the gap that you're allocated to, so usually we see patients are seen at clinics, so at GMFs, okay? They're seen at gap clinics, so those clinics are called transition clinic. And nobody's seeing at home. No, so that's more home care service. So with the gap, we're talking about ambulatory clients. So it's at clinics or transition clinics. And some gaps do have CLSC appointments. So it depends on where on the territory and how the program is put, but it's either CLSC, GMFs, or transition clinics.
Okay, so here's another hypothetical question. So let's say someone gets an appointment and they go to see the doctor and they still don't have a GP. Can that doctor that they're seeing become their GP?
They could. If the doctor has room, they see the doctor has room, then the doctor would make a request at the GAMF to have that specific patient put on their list. It has happened.
Okay, well, that's positive, I guess.
Yes.
So a question just came in, just to go back to the question about the specialists. So what does a person do if they need a referral to see a specialist, but they don't have a GP?
Okay, so then they would contact the GAP because you do need a referral. So the GAP doctor or the nurse practitioner would make such a referral for the specialist. So then you would be able to have that referral.
Sorry, I got distracted. I was reading the
No
chat.
problem. No
Okay,
problem.
that's good. So my other question is, how does the GAM confirm if you're assigned a GP?
Okay, so the doctor usually asks anywhere from 50 to 100 clients at hand, right? Oftentimes, that's the average that we see. So then the nurse that does, there's a nurse that does the assignment of patient to doctor. So the matchup, when the matchup is done, the GAMF of the territory contacts you by phone to let you know that you have been assigned a doctor. There's also another way of assignment, which is, let's say a doctor decides to take a big group of patients, a new doctor that's signing up, let's say, just graduating. So he's saying, I want to take 500 patients on right now. We send letters at that time because we can't make 500 phone calls. We send letters to advise the patient that the doctor at this clinic is taking you on with all the information. So those letters are sent by the RAM queue. So once that is done, that's how the patient is made aware.
Okay, and an interesting question just came in. They're coming in now, fast and furious. So we were talking about the wait time for on the waiting list to get a GP. And someone just said, I lost it. Can you refresh your name on the list if you haven't received a doctor after 4 years?
Yes, like I think I've mentioned that point where I encourage anybody to, if you haven't heard anything from your GAMF in after several years, to call them back and just make sure that you're still on that list and just update your medical status on that list.
Okay, and in your presentation, Farat, you said that when GPs know that they're going to retire, they have to give 2 to 6 months notice that they're leaving.
Yeah, depending on their practice.
Right, that they're not leaving but retiring. So a question just came in. If a doctor knows that they are going to retire, can they transfer their practice to another GP? And if they do that, do the files automatically transfer to the new doctor?
Absolutely, yes.
I've got to unmute myself. Is that is that common? Is that sort of the standard that most doctors would try and do that, or is that just
this is what most doctors try to do indeed, but because we don't have a lot of doctors graduating in that way, it doesn't necessarily happen where a doctor is able to take all the practice of a doctor that's retiring, because oftentimes a doctor that's coming on will gradually build their practice because they can't take, let's say, 2,000 patients from a doctor that's been, very mature, very existing for many years, that know their clients. So they have to build slowly so they don't get discouraged or swamped, or that their practice is it's secure, let's say. So a new doctor cannot take 2,000 patients, right? So they'll take it by blocks of 500, let's say. So this is what I've seen happening. So they can't take the whole practice, but I've seen like portions of a practice.
Okay, so basically it's, I don't want to use the word responsibility, but as a patient, if you know your GP is going to retire, then you have to have a conversation with them about next steps and what to do. And then if you know, for example, that they're not going to transfer the files, then you have to put yourself on the waiting list.
Exactly.
Okay. Thank you, Ruth. So Ruth just whispered a question. So if your medical file is being transferred from retiring doctor to new doctor, what happens to that medical file?
If it's at the same clinic, nothing. It's
Okay.
just a transfer at the GAMF that is being done. So at the GAMF, we assign the new doctor. So it's just a technical administrative thing at the GAMF. So your medical file, because it's at the clinic, that remains there if it's at the same clinic. If it's at a different clinic, then the new clinic has to have the patients fill forms to release their file from the previous clinic and transfer to the new clinic.
Been a
Well,
GP for
but-
6 years.
But my question is, so that ties into a question I had that I was waiting to ask, is how does a patient access their medical file? How do they go about that?
Okay, so they fill in a request form directly either at the clinic or at the hospital, and there's a form that they fill, like disclosure of medical information, and then there's different tasks like checks to do, like depending on what you want to be released as information, and then you also write where you want it to be released to.
Okay, so is it a good idea that if someone knows that their GP is gonna retire, that they request to get access to their medical files, and so they have a copy on their end if they want to get a copy?
Oh, totally,
And
yeah.
then they've got the backup of the backup?
Yeah,
And
definitely.
then, so that would be a good recommendation.
Yeah, definitely.
Okay. So my next question is, and I'm trying to find a way to word this. So
Mhm.
people stay on waiting lists because they're healthy. So the priority goes to the sicker individuals, if you will,
Okay.
if I'm understanding this.
Yeah. Mhm.
So if you're on a waiting list and your health is deteriorating, how do you prove that your health is deteriorating while you're on the waiting list to get you up the waiting list?
One thing is definitely calling us to update your file. Another thing that also indicates that your health is deteriorating is the amount of visit that you do to a clinic. Let's say those are registered at the RAM-Q. The amount of prescription that you have, those are also registered at the RAM-Q. So all those create like vulnerability factors that are put in your file, as well as when you call us to indicate, well, now I was diagnosed with diabetes. So diabetes being a chronic illness. Well, I have now I have cancer. Cancer puts you in a different category. So you also have, it's a partnership. So you also have to indicate to us changes, and some vulnerability factors are going to be put in by the RAM-Q as well.
Okay, I'm jumping a bit, sorry, it's just because questions are coming in.
Sure.
So just to go back to the accessing medical files and the transferring of medical files. So, okay, is there a cost to transferring a medical file from one clinic to another clinic?
Yes. From what I've seen, like I said, I usually see between $30 to $50 that are being charged as administrative fees from the receiving part.
Okay, and what would happen in a situation that, say, you're
releasing part, sorry, releasing part.
part?
Yeah, the releasing part.
Okay.
So let's say you address your concern at the GMF because you want your file to be transferred to another clinic. So your primary GMF is where you pay the fee. The hospital is where you would pay the fee. So the releasing part.
Okay, and then that's it. It's just a one fee.
Yeah.
Okay. And then what happens in a situation that, say, you're seeing a specialized doctor, so say a cardiologist, and your doctor passes away?
The cardiologist, or
yes, the cardiologist. So what happens to your file? Does your GP should, in theory, have access to that file, no? Or to that information?
The GP have access to a portion of it. So the portion that usually the cardiologist would communicate with them. So let's say a cardiologist sees a patient, they usually do a report to the GP. So this is why I've seen your patient, this is the plan, et cetera, et cetera. Now, they don't have necessarily access to all the testing that the cardiologist was thinking of doing, or the plan with different services. So this really belongs to the specialty part. So let's say you're being seen by a cardiologist, usually that clinic or that hospital have other cardiologists. So it's going to be a matter of transferring to one of the other cardiologists. If you don't want to stay at that facility, then you have to bring your referral somewhere else.
Okay, I think that answers that person's question. And my other question I had is just to talk about, you know, if your health deteriorates or takes a bit of a beating when you're on a waiting list. I know that, for example, pharmacists and nurse practitioners, thanks. I'm crashing a little bit right now. Pharmacists and nurse practitioners have, they can provide kind of more services than they were allowed to perhaps in the past. So I was wondering if you could maybe talk about ways that if someone is on a waiting list, that they could talk to their pharmacist, if they have a pharmacist, to kind of help improve their health. And if they do have a nurse practitioner, what they could kind of do in that sense.
Okay. One of the things that I can say is that pharmacists, I think, are underutilized, and they are a great asset because they're in every area, every street corner almost, you have your local pharmacy. So should you have any concern, any new symptoms, they often analyze the situation and tell you, well, I think this is something that I can help with, or they refer you to a physician. So then if you don't have a physician, if you don't have access to your clinic, then they'll say to contact the GAP because you don't have a family physician. So a lot of the services, that's how they're being done. So in terms of the nurse practitioner, once you contact the GAP, so like I said, the nurse is the one that assesses the situation and either refers you to a doctor and nurse practitioner. And I have to say that doctors and nurse practitioner, they do pretty much of the same thing. The only difference is that a nurse practitioner is not allowed to do any new diagnosis of mental illness. That's the only difference. I am oftentimes being followed by a nurse practitioner, and I feel very comfortable. They have a lot more time and they are able to analyze differently, and they're very thorough. So I have no concern. So I think it's a good alternative to be seen by nurse practitioners because it frees up the waiting time that you would have to wait to see a family physician. So in terms of what they do, pretty much the same thing, except new diagnosis of mental care illnesses.
Okay, and so how can someone access a nurse practitioner?
Through the GAP.
Through the GAP.
Same, yeah. But now there's also a new initiatives in different areas that are coming on where you have nurse practitioners clinic, but it's not every area that have them. And those are like any other clinic. Let's say you're trying to get an appointment, it's going to be on Bonjour Santé, RVSQ, and it's nurse practitioners, and you'll see the name of the clinic. But through the GAP, we'll tell you when we send you for a medical consultation. Okay, well, I have an appointment with a nurse practitioner. Well, I have an appointment with a physician. So that's how you have access. It's always through like those appointment portals.
Okay, and I think this will be the last question. And I think I understand what the question.
I have a question that I think I want to address. I've seen it. I don't know if that's your last question, but I'll
go for it.
I'll
if you want to go for it, go for it.
There's Toby Stewart that asked, GAP several times sends us to a clinic many kilometers distance because they cannot or will not use our correct postal code. RAMQ does not have the correct code. And they told me they do know that the GAP's dysfunctioned on codes. We don't drive and taxis are expensive for seniors on pension. how do we get the gap to change our proper postal code? It's really through the RAM-Q that you can change your postal code, okay? First and foremost. So when you register on that list for the GAMF, you put in your information. So let's say you want to update, change address, it's through the RAM-Q. We don't have access to change the address. Even at the GAMF, we don't have access to change the address. So the address is entered at the RAM-Q, then that's the information that we get. When you enter your information for the GAP, you'll see that your postal code is already related, linked to your RAM-Q card. That's because it's at the RAM-Q that that information is entered. So this is the only way to change it. And I hope I answered that question. So.
Okay, so that was not the question, but thanks for catching it, because like they're coming in really fast, so it's been a bit tricky.
And so he says, sorry, just to follow up, he says RAM-Q does have our correct postcode, but not the gap. Mr. Stewart or Mrs., I'm sorry, what area are you in? So I'll just, RPPA, I'm sorry, I'm not sure where that is. I'm not sure what RPPA is. You're in our RPA, in RPA? Rosemont,
Rosemont Petite Patrie.
Ah, Rosemont Petite Patrie. Okay, I can maybe assist afterwards, because those are very particular cases. It's not my area, so it's not my gap. It's not my but I could maybe refer to one of my colleagues in that GAMF to assist you, because this is not my area, so I can't even go in my Guichet and look what the situation is.
All right, well, the final question, just so we don't get like, case specific.
Exactly.
No, that's okay. So if a senior were to move, so the person was wondering that if they know they have to move, they have to put themselves on the GAP list. And basically that means that they deregister themselves from their GP because they're moving somewhere else and they have to find a new GP. So I guess the question is, what happens if a senior knows that they have to move? And how do they go about that to find a new GP and make sure that the files follow them and that they can find the doctor's location?
Okay, so we have what's called making someone accessible, where even if you have a GP and you're moving, you could still remain registered to that GP until you find a new GP. Okay, so you still have access to the services of your first clinic. And if you're willing to do that traveling, and it's even if it's far, because you're going on specific times every 3 months or 2 months, depending, and it doesn't bother you, you can still have access to your GP. Now, when you do find, so you're on the waiting list, but you still have access to your GP because you're moving, let's say. So there's apologies. Sorry, I see apologies. There's this way of making you available, but still on the waiting list. While you're waiting, you still have access to your primary GP.
Okay, and I just want to reiterate, I know we said this at the beginning, the presentations will be sent to everyone with the link of the recording. So not to worry, everything will be sent to everyone in a week or so. So thanks, Farat. And I'm just gonna I'm going to pass it to Ruth.
Perfect. Thank you.
Farah, thank you ever so much. It was absolutely excellent. And you touched upon so many of the basic questions and concerns that we discussed. And I'm sure that people are feeling very satisfied that you were able to answer so many questions. The system is a little complicated. But the government is doing its best to address the day-to-day situations that we all have when it comes to healthcare. And I think you've given us several options, so that is helpful. And I would assume that in each geographic region, there is an equivalent GAP, GAP.
Exactly, there is.
So we had a question from Gaspé. You have your own, so I think your staff at your wellness center could possibly look that up and give you some information on it. Like Katia said, the link to the recording will be coming out. Just give staff a bit of time because it's not the only thing that they do. And Brendan, I thank you very much for all your technical support in the background. I thank everybody for giving us the time on such a gorgeous day. Farah, all the very best to you. We'll stay in touch, and thank you. It's been tremendous.
It's been a pleasure to assist.
And I wish everybody a good rest of the day. Thank you.
Likewise. Take care.
Thanks. Bye-bye.